Hi guys, this is Dr. Fatma Qureshi again. Good morning. I know you guys must be wondering, where did she go? Why didn't she post videos? But I just got busy with patients and other stuff. But that doesn't mean the interesting cases weren't coming to us right and left. I have been seeing some trauma cases lately. They were referred to me from the urgent care and emergency, so from the ER, and I thought maybe this is the best time to go over some of the cases. Unfortunately, I don't have the pictures for every case. For instance, there was this fish hook injury case that came to me, and this guy was maybe in his 20s, like mid 20s. He was fishing, which is very, very commonly done. It's like a sportsman's paradise, Louisiana, right? So he was fishing, he was not wearing his sunglasses, and it's a dangerous sport at some level, I guess, if you're not protecting your eyes. So the injury happened because of the fish hook. He caught the fish, but the hook went into his eyeball, and I had to treat him with steroids and antibiotics, and finally I had to refer him to a retina specialist because he had some retinal trauma also, chorioretinal trauma. If I find the pictures to that case, I will definitely discuss it again. But for today, I was thinking maybe I will show you this cool case. And here it is. You can see this guy came to me and he gave his consent, to post his picture. So this is the contusion that you can see, and a hematoma like right there. If you look at the arrow here, he fell, actually. This gentleman fell on his head, and he had this entire bruising, contusion, hematoma in this area. So if something like this comes to us, the first thing that we have to do is obviously check the anterior part of the eyeball, which is the lid, the cornea, to see if there's any abrasion or ulcer on the cornea. You also have to take into consideration the nasal area here to see if there's any fracture or deviation of the septum, and then the orbital fracture. So this is the orbital bone area, and then the paraorbital area. You have to look for any signs of maybe possible fracture. So what I did for this patient is I put him on antibiotic. I put him on 10 days antibiotic course, and I also put him on some local, actually topical steroids, and I advised him to do warm compresses and alternate them with cold compresses. His vision, fortunately, was not very bad at that point, and then I'll show you what happened when he came back in about 10 days. This is his picture from day 1, and then day 10, this is his pictures. Look at that. How beautiful is that? So all the edema, swelling is gone. And I also had sent him for CT scan of the orbits just to make sure he did not have any kind of fracture. It came out negative. Even the nasal area looked fine. There was no fracture going on. And this area, if you look here, is just the normal healing process. It's just the bruising, which eventually is going to get better. And sometimes I also put them on some kind of a topical ointment, such as Maxitrol, which is neomycin, polymyxin, and dexamethasone combined together, so antibiotic along with steroid. But he didn't really need it. He was healing really, really good. We did not need any stitches in this area because he did not have any lacerations. So this is a great healing process for him. And the best thing is that the patient was listening, okay? So the most important thing I want to, the take-home message I want to give to you guys is that listen to your doctors. Come to us at the right time. He didn't wait, he just didn't sit at home thinking that everything is miraculously going to get better. He didn't do home remedies. He actually came to us at the right time, listened, followed instructions, was compliant, and he is doing so much better. Okay, so when I see more interesting cases, I'll keep posting the videos. Sometimes I get busy with patients, and you guys are doing awesome. You've been subscribing to the channel, you've been sending comments, you've been liking. So thank you so much for all the love and appreciation. You guys have a wonderful rest of the day. Take care. Bye-bye.